Well, again, I'm Dr. Tony Rakovic, Euclid Chiropractic in Upland. We'll talk about today is a car accident, how to deal with them. If you're in an accident, what are you going to do? Okay, you need kind of a game plan with how you're going to treat your body and what you're going to do to make sure things recover completely, even if you don't have any pain. Sometimes accidents as low as 5 miles per hour with the same car mass hitting another one can cause injury, and depends on your previous conditions, what have you. What chiropractors do differently is we usually start with an x-ray, if you don't have one from the hospital or somewhere else too, and kind of tell us what's going on, okay? The x-rays for us are the priority because they tell us if the ligaments have been torn, if there's structural damage too, if there might be a slight fracture or break, or even a muscle tear. Okay, we can show that because the x-rays show normal alignment, such as these up here. I'll show you in a second what these are. And overall, what they'll do is show us where things may have been before, may have been after the accident. Our job is to make sure the number one thing is how to get back to 100%, 100% to your normal, okay? So I'm going to walk through this real quick with you and show exactly what a normal x-ray should look like. We'll kind of talk about too what it can become abnormal, what those differences might be. Here's a normal neck x-ray. And normal meaning we look for three things. Three things meaning one is going to be alignment or the curve of the spine. One is the disc spacing. We want to have normal space between each vertebrae. Symmetrically all the way through. They look about the same height all the way through. Last thing we want to have is where all the bones line up properly, part of the alignment, to where this bone lines up with this bone. Here, 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 here. The fourth thing, which is very specific to the neck, is the first bone, the atlas between the skull and second vertebrae, should have that normal spacing too. That tells that the head is back, it's not forward, and overall that spacing allows the nerves to come and arteries to come through the neck into the head itself. This is a normal alignment, say before an accident. Sometimes in an accident we'll see the spine, instead of being curved backwards, where it's very straight. Okay, that can happen. Sometimes we'll see front where there are aerial fracture in the very front of the vertebrae called a revulsion fracture, and sometimes we'll see those spaces decrease over time. With that complex, with the accident or whiplash concept, at that point, this first bone, instead of being flat 25 degrees, become more angled or more straight across, more horizontal. So it'll cause that to happen. So overall, our goal, if that happens when the spine straightens out, this bone becomes more flat, our goal is to get it from here back to better normal so it looks like a better normal. Accidents are easier to treat because things happened yesterday, last week, the last few weeks. It's not something that's more chronic that happened over a period of months and years. What happens to accident too, the last part, soft tissue-wise, when the spine is whiplash backwards then forward, then it causes ligaments in the very front and back, to stretch and overstrain. And like rolling an ankle, that strain and stretch will cause pain and lock up the spine. When it does that, it makes it lock up this way. We have to get things to stretch and come backwards before it wants to calcify and become like scar tissue and wants to stay that way. See, pain can go away real easy. The problem is, how do we get it to come back here first, increase all the range of motion of the vertebrae, and then get the lock in that way instead of where it can happen from a car accident. Here's also lower back x-ray, and the same concept of the neck has a normal curve. We want to get that curve back to normal. The ligaments in the front or the back have strained, and also the disc spacing. These are bigger bones because it has more and more load. And with an accident, sometimes it can cause things to get squished together. We want to make sure they recover completely. So where we open things up, all these spaces get to a better normal, that curve comes back into play, and there's normal motion in the spine. See, like the lower back, as big as it is, it has to hold all the body weight. So it needs a normal spring for that to occur. So we want to make sure with an accident, that spring returns and that stays normal even after we start treating somebody. I hope that explains what chiropractic can do for you in a car accident and kind of diagnose it properly. So at that point, the big picture is, how do you recover from an accident completely? Even if there's no pain at all, then make sure there's no pain in the future, no arthritis in the future, and nothing that's going to limit you even after the case closes. So our job is to make sure we clear you out from having an injury or treat something that actually can be prevented and corrected while you're here. So any questions about being an accident or things like that, call our office. We can always do a free consultation and free exam and kind of make sure you're going to be okay from an accident if you have something like that happen to you. Okay, any questions, give us a call at the office. Have a great day.